Welcome to RFBI's 2023 Annual Review presentation. I'm Frank Price, the CEO of RFBI, and I thank you for joining us today as we reflect upon the year that has been, our successes, and what we have planned for the year ahead. We are grateful and relieved that things are finally getting back to normal after the challenging times we've faced during the COVID-19 pandemic. I want to recognise our incredible staff for their dedication and resilience during this period, ensuring the safety and well-being of our residents, clients, families and each other. With an ageing population, the need for quality aged care services is more pronounced than ever. This presents both challenges and opportunities for us, and RFBI is responding by investing in our buildings, investing in our people and investing in our future by looking at innovative ways we can respond to the needs of residents and clients now and into the future. Over the next 5 years, RFBI will be investing $280 million in our buildings. The investment will see a number of our existing villages revitalised, construction of new communities and the establishment of staff accommodation solutions. We're also investing in our IT infrastructure. Approximately $2 million was spent in this past financial year upgrading our clinical and financial systems, our phone systems, our Wi-Fi network, cybersecurity and installing a new ticketing system that allows our teams to better respond to and track IT usage and issues. Technology will play an increasingly important role in the delivery of aged care services and governance of those services, and our ongoing investment in our IT infrastructure reflects this. At RFBI, we know that our staff are the heart of our organisation. We are committed to investing in their training, development and well-being so that they can continue to deliver the highest level of care and build a career in the industry. Workforce is an ongoing industry challenge. For over 2 years, RFBI has been responding to this challenge by working with the government to create new channels for us to be able to recruit from international markets to supplement our local recruitment efforts. In 2021, we launched our first international recruitment program, and this year expanded that to welcome experienced healthcare professionals from other countries into our services. We're now working on a program to support these staff achieve their Australian nursing registration. There is more work to do, but our efforts are proving effective and are helping to reduce our workforce shortages. We were delighted with the recent 15% wage increase to the Modern Award for direct care workers. This is a great first step, however, only addresses some of our workforce. We are continuing to work with our peak body and lobby the government directly to support a similar outcome for all aged care workers when the Fair Work Commission meets later this year. In the meantime, all our RFBI employees that were not covered by the Fair Work determination received a 5% increase to their wages, which took effect in July 2023. Throughout the rest of this presentation, you will hear from our leadership team on more of what we have achieved over the past 12 months and key areas we are focusing on this financial year. I hope you enjoy the rest of our annual review presentation. I now invite our Chairman, David Adams, to share insights from our Board of Directors and an update on our benevolence program.
Thank you, Frank. I also extend to you a warm welcome to RFBI's 2023 Annual Review presentation. This past year has been challenging for everyone as we emerge from the COVID-19 lockdowns. However, I'm incredibly proud of the way RFBI has managed this crisis and the steps we've taken to rebuild connections with our local communities and enrich the lives of our residents. We are fortunate to have the primary health networks and health specialists work alongside us to provide high quality care for our residents. However, it has been increasingly difficult to access GPs and health practitioners, particularly for our residents living in rural areas. RFBI is investing in innovative strategies to address this issue and have, through collaborative efforts with our local primary health networks, introduced telehealth services. Telehealth services will allow us to bridge the gap and provide our communities with accessible and high-quality healthcare services. We are committed to ensuring that our teams deliver the highest quality care and is able to meet the new reporting requirements associated with the new quality indicators. I congratulate the work our quality and development team has undertaken to introduce CompliSpace, which gives us the ability to better report and monitor our care services. With the launch of Policy Connect and Assurance this year, we now have a platform that integrates our policies, procedures and continuous improvement plans, delivering a single source of truth for those key documents. I also want to commend the work of our risk and compliance team, who have worked alongside our village teams to support the delivery of care services. We had 15 undergo re-accreditation this year and all achieved the maximum 3-year accreditation. This is a fantastic result and reflects the hard work and dedication of all our team members. I congratulate you all for these excellent results. RFBI has a proud tradition of helping those in need, and we continue this legacy today through our benevolence program and annuity scheme. This financial year, the board has reviewed nearly 20 benevolent requests and is supporting 10 individuals and families through our annuity scheme. We have supported MHERV, the Men's Health Education Rural Van, which is saving lives across New South Wales by providing free health checks. We are also proud to support our local communities and to have provided another 3 defibrillators to Masonic lodges in Berry, Glen Innes and Port Macquarie. We could not provide this support without the generosity of our benefactors. So I'd like to take this opportunity to extend my heartfelt thanks to everyone who has donated to RFBI. No donation is too big or too small, and every dollar we receive is used to support people in need. Before I conclude, I want to extend my thanks to Frank Price and the entire leadership team and our dedicated staff. You are doing an amazing job, and I thank you for your hard work and ongoing dedication to supporting our residents, families and clients. I also thank our valued residents, clients and their families for your unwavering support, understanding and patience over the past year. It is very, very much appreciated. Thank you.
Next up is James Shaw, Deputy CEO and Chief Financial Officer of RFBI, and he will share his financial update.
Thank you, Frank. The past year was always going to be a year of significant change and difficult on RFBI and the aged care industry. The year was certainly marked in 2 halves financially. In the first half, COVID outbreaks continued to impact every community, and during the first 6 months of the year alone, we had over 650 days of outbreak in our villages, costing our organisation over $5 million. However, as Australia moved out of lockdowns and into a position of living with COVID, we started to see the impacts of COVID reduce. We were all very happy to see the removal of mandatory mask wearing within residential aged care villages in September this year, allowing us to finally see each other again. The ongoing pandemic didn't stop the regulatory changes coming through. A new funding arrangement came into effect in October. Additional reporting requirements were added to the reporting burden borne by providers, and care minute targets were set. As RFBI has done in the past 143 years, we tackled these challenges head on. We enacted workforce strategies to supplement and provide additional support to our existing staff, and as a result of early preparation and planning, we were ahead of the industry when the new funding arrangements commenced in October. Financially, the aged care industry still struggles. Despite the additional funding built into ANAC, over 60% of the industry continues to operate at a loss. RFBI's strong balance sheet and prudent fiscal management meant we were able to improve our financial position. Whilst we have reported a loss of $6.7 million for the year, this was a significant improvement on the previous year and puts us in good position for the coming year. Looking to the future, we continue to prepare for changes still to come to the aged care sector, investing heavily in our buildings and our capital infrastructure, our IT systems, our workforce and sustainability. Together we weathered the COVID pandemic, and I thank every staff member and volunteer for your dedication, commitment throughout the year and for your hard work in looking after our residents and clients.
An important initiative that we commenced a few years ago was the Leadership Roadshow. The Roadshow was designed to create an opportunity for our residents, clients, families and staff to meet with myself, Luann Riboldi, our Chief of Operations, and members of the leadership team so that they can share with us what is working, areas we can improve, or simply their experience of living or working with us. Luann Riboldi will now share with you the insights we gained through these discussions.
Thanks, Frank. It's my pleasure to share with you the highlights of our 2023 Leadership Roadshow and how we are using the insights we've gained through these discussions to improve our services. This year's Roadshow commenced in May 2023, and it was the first we have been able to run since the 2019 pandemic. Frank Price and I visited each of our residential care villages and met with residents, families and staff in each location. We also arranged separate sessions for our care at home clients so they too could speak with us and share their thoughts. The Roadshow provided an informal and relaxed setting for our residents, families, clients and staff to come together and freely express their thoughts and share their experiences of living and working at RFBI. In some instances, our Board of Directors joined us, making these visits even more special. The sessions were very well attended, and through the discussions we've been able to gather valuable feedback and insights. Overall, the feedback was very positive, and it was heartwarming to hear the many messages of thanks our residents and our families expressed to our staff during these sessions for their hard work and high quality of care they provide. The focus of our staff meetings at the start of the Roadshow focused heavily on the wage increases that were coming into effect at the time. These sessions also allowed us to discuss with our teams their thoughts on our wellbeing program and share ideas on how teams are leveraging the program to build camaraderie and create opportunities for them to come together socially. I thank everyone who participated in our Leadership Roadshow sessions for your time and for sharing your thoughts. Work is now underway to introduce some of the ideas generated through these discussions to improve the experience for all who live and work with us. Thank you.
Alison Pearce, our Chief of Strategy and Innovation, and I travelled to Fiji to meet with degree qualified nurses as part of our new international recruitment program and extended an offer inviting them to live and work in Australia. Alison will now take you through our overseas recruitment program.
Thank you, Frank. As you're aware, the aged care sector is facing a workforce crisis. RFBI, like all aged care providers, is finding it harder to recruit enough staff to meet the needs of our residents and clients. Building on the success of our Global Citizen Exchange Programme and continuing to use our Immigration Labour Agreement, we've extended this successful approach to bring internationally qualified nurses from Fiji to work as carers in our villages. An induction program at head office and at the village helps provide an overview of RFBI and Australian life and their new role. Local accommodation is provided when they first arrive, so they can settle in and explore their new homes without the stress of trying to find somewhere to live. Once they're settled, we then help them secure a rental in the community. This program has proved successful, with 29 Fijian staff joining 11 of our villages since February this year. It's great to hear that with the support of their local colleagues, they're settling in so well, and that their knowledge and commitment is enhancing our local team's ability to provide such excellent care. With their arrival, it brings our total number of internationally qualified nurses to 94 across 20 of our villages. We're now working with these staff to help them achieve their Australian registration.
I would like to now introduce you to our new Chief of People and Culture, Anna Maria Wade. I'm so happy to have Anna Maria join our team as she brings a wealth of experience and knowledge that is so beneficial to RFBI.
Thank you, Frank. I'm delighted to share with you a new cultural program we've introduced at RFBI to support a greater understanding of how we each work and how these differences can actually make us a stronger, more productive team. Towards the end of 2022, we launched the Fruit Cultural Program as a pilot initiative with our Care at Home team. The program uses a quiz to identify core traits of each staff member and then places them into one of 4 fruit categories: apple, banana, mango and lime. Using a light-hearted and fun approach, the Fruit program helps highlight how people with different work styles think, respond and interact. It calls out the common pros and cons of each fruit type style and offers helpful tips on how we can leverage these to better understand each other and work together. The trial produced immediate effects, and based on the positive feedback of the Care at Home team, the program was rolled out across the rest of the organisation this year. The People and Culture team conducted workshops across all RFBI villages and at our head office, bringing staff together to explore the different fruit personalities, identify who was in each group and discuss in what ways we could use this knowledge to work better together. The Fruit program is being kept alive in each of our villages through an ongoing engagement plan that sees every team engage in one fruit-themed activity each month.
Across New South Wales, regional and rural communities are experiencing GP shortages, making it harder for community members to access health professionals when they need to and within their aged care village. To address this, RFBI is pleased to be introducing a telehealth service across our residential aged care services. Alana Parker, Chief Marketing Officer, has been working closely with Amanda Woodlands, our nurse practitioner, to introduce our telehealth service to 19 of our villages.
Thank you, Frank. Accessing health professionals is becoming more difficult, particularly in regional areas, and RFBI is proud to lead the way in the integration of telehealth services at our residential care villages. Our goal is to reduce barriers to accessing GPs and other health professionals for our residents by allowing health professionals to conduct comprehensive consultations remotely, reducing the need to travel, wait times, and hospital visits. RFBI was pleased to receive $150,000 in grant funding from our local primary health networks and has doubled this investment by contributing an additional $150,000 to acquire Vision Flex telehealth carts for 19 of our 22 villages. These carts are the leading edge solution and revolutionise telehealth appointments. As well as supporting high quality video and voice communication, the Vision Flex carts allow medical practitioners to utilise a range of real-time diagnostic tools during the consultation to support decision-making and care planning. With this technology, healthcare practitioners are able to listen to a resident's breathing, monitor their heart rate and blood pressure, assess wounds, check skin integrity, and so much more. They can also make high-quality recordings, capture images, and document care notes that can be saved directly into a resident's file, significantly reducing the administrative burden of a typical telehealth appointment. Another benefit of the Vision Flex technology is the ease in which it allows us to involve family members in telehealth appointments, even if they cannot physically be in the village with the resident. While telehealth services will never replace the value of face-to-face appointments, we see telehealth as a vital support resource for GPs and other medical practitioners in providing care. To date, telehealth carts have been delivered to 17 of our villages, and we have hosted special show and tell events at 8 of these to showcase the Vision Flex technology to residents, families and health professionals. Feedback from these events has been extremely positive, and we look forward to rolling these out at more of our villages over the coming months.
There are many more changes coming to the aged care sector, some driven through legislative reform and some driven by an ageing population. However, with our dedicated team and the investments we are making in our buildings, our workforce and our IT systems, we are well placed to meet these challenges so that RFBI continues to be a place where people want to work and our villages a place older Australians want to call home. Thank you for tuning into this year's annual review. I hope you found it informative. Thank you and goodbye.